8 years ago, I sat across from a patient named Margaret, a 73-year-old retired schoolteacher from Nashville. She had been dismissed by two different doctors, told she had acid reflux, told she was just stressed, told her back pain was from aging. Margaret was not stressed. Margaret was not aging badly. Margaret had pancreatic cancer and her body had been screaming for help for months. Nobody was listening. Here is what terrifies me. The warning signs were all there, every single one of them. But because they looked like other things, because they felt like normal aging problems, they were ignored. And that delay cost her precious, precious time. Today, I am going to show you 8 symptoms that your body uses to warn you about pancreatic cancer. Some of them will genuinely shock you. Some of them you have probably already dismissed as nothing. And one of them, the one I will reveal at the end, is so commonly misunderstood that most people chalk it up to eating the wrong foods. But it is not the food. It never was. Stay with me until the end, because the final symptom on this list is the one that almost always appears first, months before anything else, and yet it is the one that gets ignored the most. If you know what to look for, you could have a critical head start. If you are already feeling uneasy, that is good. That means you are paying attention. Hit that like button right now because this information could genuinely save your life or the life of someone you love. I am Dr. Patricia Holloway, a physician specialized in senior health with over 15 years of dedicated clinical experience. I have worked with thousands of men and women over 60, helping them navigate the moments when their bodies try to communicate something urgent. What I am about to share goes against the dismissive attitude that far too many doctors take with older patients. I have seen it destroy lives, and I refuse to stay silent any longer. Let me explain what we are dealing with. The pancreas is a long, flat gland tucked behind your stomach. Most people never think about it until something goes wrong. And here is the devastating part. Pancreatic cancer is called a silent killer for a reason. The pancreas sits in a location where tumors can grow for months without pressing on anything that causes obvious, unmistakable pain. By the time most people are diagnosed, the cancer has already progressed. According to data from major cancer research institutions, the 5-year survival rate for pancreatic cancer remains one of the lowest of all cancers, largely because of late detection. But here is what the research also shows. When caught early, outcomes improve dramatically. The problem is not that the body does not send signals. The problem is that we do not know what signals to look for. After 60, your immune response, your digestive efficiency, and your hormonal balance all shift. The symptoms of pancreatic cancer can look almost identical to conditions like gallbladder issues, diabetes onset, irritable bowel syndrome, or simple indigestion. This is why so many people are dismissed. This is why so many people dismiss themselves. But you are not going to be one of them. Not after today. Before we dive in, I want to ask you something. How old are you right now? Are you in your 60s, 70s, maybe 80s? If someone in your family has ever had pancreatic, colon, or any digestive cancer, type family in the comments right now. I want to know how many of you carry that risk, because what I am about to share is especially critical for you. Now, let us go through all 8 warning signs, starting with the ones that are easier to explain away and building toward the ones that should make you pick up the phone and call your doctor today. Symptom number 8, unexplained weight loss. This one sounds obvious, but here is why people ignore it. When you are over 60 and you lose a few pounds without trying, the reaction from friends, family, even some doctors is often positive. You look great. You must be eating better. That is wonderful. Nobody questions unexpected weight loss in older adults the way they should. But here is what is happening inside your body when pancreatic cancer is present. The tumor interferes with the pancreas's ability to produce enzymes needed to break down and absorb nutrients. Your body is literally not absorbing what you eat. You can be eating the same amount of food, or even more, and still be starving at the cellular level. On top of that, the tumor itself is consuming energy your body would otherwise use for normal function. A study published in the Journal of Clinical Nutrition found that significant unintentional weight loss, defined as losing 5% or more of body weight within 6 to 12 months without a change in diet or activity, is one of the most consistent early markers across multiple cancers, including pancreatic. If you have lost 10 pounds without trying. If your clothes are fitting differently and you cannot explain why, do not celebrate. Investigate. The pro tip here is this: weigh yourself regularly and write it down. Many people only notice weight loss when others comment on it. By keeping a simple weekly log, you can catch a 5% drop before it becomes 10. Symptom number 7. New-onset diabetes or sudden worsening of existing diabetes. This one is deeply misunderstood, and I need you to pay close attention. There is a well-documented relationship between pancreatic cancer and diabetes. The pancreas is responsible for producing insulin. When a tumor develops in the pancreas, it disrupts insulin production. This can cause blood sugar levels to spike in people who have never had diabetes before, or it can cause existing, well-controlled diabetes to suddenly become erratic and difficult to manage. Research published in the New England Journal of Medicine showed that a significant percentage of pancreatic cancer patients received a new diabetes diagnosis within 24 months before their cancer was identified. In other words, the diabetes was the warning, but nobody connected the dots. Here is what this means for you. If you are 65 years old and you suddenly develop type 2 diabetes without significant changes in your diet or weight, if you are someone who has managed your blood sugar well for years and suddenly your numbers are all over the place, despite doing nothing different, these are not just metabolic changes. These could be your pancreas sending an emergency signal. I am not saying every new diabetic has cancer. Absolutely not. But I am saying that new-onset diabetes in older adults, especially when accompanied by weight loss, deserves investigation beyond just starting a medication. Talk to your doctor. Ask specifically about your pancreas. Ask for imaging if the diabetes came on suddenly and unexpectedly. Symptom number 6, digestive discomfort, nausea, and changes in appetite. This is the one that gets written off as stomach problems more than any other on this list. And it makes sense why. Indigestion, nausea, and appetite changes are so common in people over 60 that they rarely raise alarms. But there is a specific pattern associated with pancreatic cancer that is different from regular digestive upset. The pancreas produces enzymes that are critical for breaking down fats, proteins, and carbohydrates. When a tumor impairs this function, you begin to feel persistently full after eating very small amounts. You may feel nauseated, especially after fatty meals. You may notice that foods you used to enjoy now make you feel sick. Your appetite may disappear not because you are depressed or stressed, but because your body has quietly learned that eating is followed by discomfort. Studies from Frontiers in Aging have noted that persistent upper abdominal discomfort, particularly after meals, combined with early satiety, that feeling of being full after just a few bites, is a pattern worth evaluating for pancreatic involvement. This is not heartburn. Heartburn burns. This is a dull, persistent discomfort that does not go away when you take antacids. This is a quiet, steady nausea that has become your new normal. If that sounds familiar, please do not normalize it. Before we continue to the next symptom, if you are finding this information valuable and it is making you think about things differently, I am going to ask you for 2 simple things. First, hit the subscribe button. My mission is to give adults over 60 real, honest health information they can actually use. Second, share this video right now. Think about someone in your life who has been dismissing unexplained symptoms. One click from you could be the moment everything changes for them. Symptom number 5. Back pain that will not go away. Back pain and aging. Almost every older adult has some degree of back discomfort, and that is precisely why this warning sign is so easy to miss. But there is a type of back pain associated with pancreatic cancer that is different from the musculoskeletal aches most people experience. The pancreas is located in the retroperitoneal space, meaning it sits behind the stomach and in front of the spine. When a tumor grows, particularly in the body or tail of the pancreas, it can press against nerves and surrounding structures in the back. The pain this causes tends to be deep, dull, and persistent. It is often felt in the mid to upper back, not the lower back where most age-related pain occurs. It can radiate from the abdomen around to the back, or it can start in the back and work its way forward. Here is the distinguishing detail. Pancreatic cancer-related back pain often worsens after eating and tends to improve slightly when you lean forward or curl into a fetal position. That is because leaning forward takes some pressure off the inflamed tissues around the pancreas. If your back pain consistently gets worse after meals, if it wakes you up at night, if leaning forward gives you even a moment of relief, this is not typical arthritis. This is a red flag that deserves attention. I remember William, a 78-year-old retired engineer from Chicago. He had been living with what he assumed was chronic back pain for nearly 8 months. He had seen a chiropractor 3 times. He had tried physical therapy. He had taken anti-inflammatory medications. Nothing worked. When he finally came to me and we discussed the pattern, I noticed that his pain was reliably worse after dinner and that he instinctively leaned forward in his chair while eating. Within 2 weeks of imaging, we had answers. Difficult answers, but answers that gave him options. He told me, "Doctor, I just thought I was getting old. I never imagined my back was telling me something this serious." This was not just aging. This was his body fighting for his attention. And finally, someone listened. This was not a miracle of detection. This was a patient who finally had someone ask the right questions. You can ask those same questions. You deserve those questions. Symptom number 4. Changes in stool, specifically pale, greasy, or floating stools. I understand that nobody likes to talk about this, but I need you to stay with me because this symptom is one of the most telling and one of the most ignored on this entire list. When the pancreas is functioning properly, it releases bile and digestive enzymes into the small intestine to help break down food, especially fats. When a tumor blocks the bile duct, or when the pancreas can no longer produce adequate enzymes, something very specific happens to your stool. It becomes pale, sometimes gray or clay-colored, instead of the normal medium to dark brown. It becomes greasy or oily, and you may notice an oily film in the toilet water. It tends to float because of the high undigested fat content. It often has a particularly strong, foul odor that is different from normal. This is called steatorrhea, and it is a direct consequence of bile duct obstruction or pancreatic enzyme insufficiency. Research consistently identifies changes in stool characteristics as one of the earlier observable signs of pancreatic involvement, particularly when combined with weight loss or abdominal discomfort. This is not something to be embarrassed about. This is something to note, describe to your doctor, and take seriously. If your stools have changed in color, texture, or buoyancy over the past few months and the change has been consistent, that is information. Valuable, potentially life-saving information. The pro tip here is simple. If you notice this change, take a photo. I am completely serious. When you are sitting in a doctor's office trying to describe stool consistency under pressure, your words may not do it justice. A photograph takes the guesswork out entirely. If you believe in the power of knowing your body's warning signs, type yes in the comments right now. If you are still skeptical that symptoms this subtle could mean something this serious, type 0. Either answer is valid. This is a conversation I want you to be part of. Symptom number 3. dark urine and itchy skin. These two symptoms often appear together, and understanding why tells you something critical about what is happening inside the body. When a pancreatic tumor grows near or presses on the bile duct, bile cannot flow freely into the digestive system the way it should. Instead, bile backs up and enters the bloodstream. One of the key compounds in bile is bilirubin, a yellowish pigment that the liver normally processes and excretes. When bilirubin accumulates in the blood, the first places it tends to show up are the urine and the skin. The urine becomes a deep, dark amber or brown color, sometimes described as the color of tea or cola. The skin can begin to itch, sometimes intensely, because bilirubin depositing in skin tissue irritates nerve endings. This itching is not a rash. There is no visible breakout, no hives, no dry patches in most cases. It is a deep, persistent itch that does not respond to moisturizers or antihistamines because the cause is internal, not external. It tends to be worse at night. It can be maddening. Studies published in major gastroenterology journals have identified dark urine and unexplained pruritus, which is the medical term for itching, as warning signs that lead to pancreatic cancer diagnoses in a meaningful percentage of cases when patients report them promptly. The challenge is that dark urine can also mean dehydration, and itchy skin can mean a dozen other things. This is why the pattern matters. If your urine has been consistently dark even when you are drinking plenty of water, and if you have developed a new itch that has no obvious cause, and if either of these has appeared alongside any of the other symptoms we have already discussed, please call your doctor today. Not this week. Today. Symptom number 2. Jaundice, the yellowing of skin and eyes. If symptom number 3 is the quiet warning, symptom number 2 is the alarm going off at full volume. Jaundice, the visible yellowing of the skin and the whites of the eyes, is one of the most well-known signs associated with pancreatic cancer, and it occurs for exactly the same reason as dark urine and itchy skin. Bilirubin accumulating in the bloodstream and depositing in tissues. The yellowing often begins in the eyes. Many people notice it first in the bathroom mirror, or someone they love points it out. The whites of the eyes develop a yellow tint. As bilirubin levels continue to rise, the skin itself begins to take on a yellowish cast, sometimes subtle, sometimes unmistakable. Here is the critical information. Jaundice caused by pancreatic cancer is what doctors call painless jaundice, particularly in the early stages. This is what makes it so dangerous and so important. Many people see yellow eyes and assume it must involve liver problems, and they wait and see if it resolves on its own. Because it does not come with severe pain initially, they convince themselves it cannot be that serious. According to oncology research published in the Journal of the American Medical Association, painless jaundice is one of the presenting symptoms in a significant proportion of early-stage pancreatic cancer cases, making it one of the most actionable warning signs because it is visible and it is undeniable. Jaundice is never normal. Jaundice is never something to wait out. If you or someone you love develops yellowing of the eyes or skin, even mildly, even without pain, this requires immediate medical evaluation. Not a call to schedule an appointment for next month. An immediate evaluation. I remember Linda, a 68-year-old retired librarian from Boston. Her daughter noticed the yellowing of her mother's eyes at a family birthday dinner. Linda had been feeling off for weeks, tired, mildly nauseated, had lost a few pounds, but nothing that seemed alarming. She had planned to mention it at her next routine appointment. Her daughter insisted they go to urgent care that same evening. That insistence changed everything. Linda's cancer was caught at a stage where surgery was still a viable option. She went through treatment, and 2 years later, she was at another family birthday dinner, dancing with her grandchildren. She told me, "Doctor, I keep thinking about what would have happened if my daughter had not said anything that night. If I had waited another month to bring it up at my regular appointment." She had tears in her eyes. not of sadness, of gratitude. This is what I mean when I say knowledge saves lives, not the knowledge in textbooks, the knowledge you carry in your own mind about what is normal and what is not. Hit that like button right now, because what I am about to share is the symptom that almost everyone gets wrong, the one that appears first, the one that is hiding in plain sight. Symptom number 1: persistent, vague abdominal discomfort and a subtle feeling that something is simply not right. I told you this one would shock you, not because it is dramatic, but because it is so ordinary that it almost never gets taken seriously. And yet, in my 15 years of clinical experience and in the published research on early pancreatic cancer detection, this is the symptom that patients consistently report having experienced the longest before their diagnosis. It is not sharp pain. It is not a crisis. It is a low-grade, persistent feeling of something being off in the upper abdomen, sometimes described as pressure, sometimes as a vague ache, sometimes simply as a sense of fullness or heaviness that was not there before. It may come and go. It may be mildly worse after eating. It does not send you to the emergency room. It sends you to the antacid aisle. And that is exactly why it is so dangerous. Research in Frontiers in Aging and multiple oncology journals has documented that a large proportion of pancreatic cancer patients report having experienced vague, persistent abdominal discomfort for months, in some cases over a year, before receiving their diagnosis. Not because doctors ignored a dramatic symptom, but because neither the patient nor the doctor treated a mild, persistent symptom as a priority. Here is the mechanism. In the early stages, as a tumor begins to develop in the head, body, or tail of the pancreas, it may not be pressing on any major nerve or organ forcefully enough to cause acute pain. But it disrupts the local environment. Inflammation begins. Digestive enzyme release becomes inconsistent. The surrounding tissue responds, and the result is this quiet, persistent signal that something has changed. Your body knows. It is trying to tell you. The question is whether you are willing to listen. I want to be very clear about something. I am not telling you to panic every time your stomach feels off after a heavy meal. I am not telling you that every digestive complaint is cancer. What I am telling you is this. If you have had a persistent feeling of something being wrong in your abdomen for more than 4 to 6 weeks, and especially if any of the other 7 symptoms we discussed today are also present, that is not a wait-and-see situation. That is a call your doctor and be specific situation. Tell your doctor exactly what you told me today. Tell them it has been going on for weeks. Tell them it is not resolving. Tell them you want it investigated. Now let me tell you exactly what to do with everything you have just learned. Starting today, here is your action plan. First, do a body check. Sit down with a piece of paper and go through every symptom we discussed. Write down which ones apply to you, how long they have been present, and whether they are getting better, staying the same, or worsening. This document becomes your medical conversation starter. Second, look in the mirror. Check the whites of your eyes. Ask a trusted family member to look as well, because sometimes we stop noticing gradual changes in ourselves. Any yellowish tint, any question in your mind, call your doctor. Third, pay attention to your bathroom. I know it feels awkward, but for the next 2 weeks, take a moment to observe your urine and your stool. Color, consistency, floating. Write it down if anything seems different. Fourth, track your weight. Weigh yourself every week, same time of day, same conditions. A loss of 5% or more of your body weight over 6 months without explanation is a reason to have a direct conversation with your doctor about your pancreas. Fifth, do not minimize yourself in the doctor's office. Do not say, "I am probably just getting old," or "I am sure it is nothing." Say, "I have had this symptom for this many weeks, and it concerns me. I would like it investigated." You have every right to that conversation. Do not make these critical errors. Do not wait until symptoms become unbearable. Pancreatic cancer is dangerous precisely because it often does not become unbearable until it is advanced. Do not accept a dismissal without asking what else it could be. You are your own best advocate. And do not avoid the topic because it feels frightening. Knowledge is not frightening. What is frightening is silence. Here is my challenge to you. Commit to 1 week of paying attention. 1 week of noting how your body feels, what your bathroom habits look like, how your appetite is behaving, whether there is any discomfort in your abdomen or back. 1 week. Your body has been talking to you. Give yourself 1 week to actually hear it. We went through 8 symptoms today. Unexplained weight loss, new or worsening diabetes, digestive discomfort and appetite changes, persistent back pain, especially worse after eating, stool changes including pale, greasy, or floating, dark urine and itchy skin, jaundice, the yellowing of eyes and skin, and the one that comes first, the quiet, persistent feeling in your abdomen that something is simply not right. None of these symptoms alone means you have pancreatic cancer, but any of them, especially in combination, especially when they have been present for weeks, deserves attention, deserves investigation, deserves the respect of a real medical conversation. You are not broken. You are not just aging. And you are not being dramatic. You are listening to your body. And that is the bravest, most intelligent thing you can do. Now I want to hear from you. Have you experienced any of these symptoms and written them off as nothing? Share your experience in the comments. I read every single one. Your story might be the thing that convinces someone else to finally make that appointment. If this video helped you, smash that like button. Subscribe to this channel so you never miss information like this. And please, share this with someone you care about, an aging parent, a sibling, a friend who has been complaining about vague stomach issues for months. A single click from you could be the moment that changes their story. Because remember, aging does not take away your body's ability to send you signals. It simply asks you to listen more carefully. Take care of yourself.